Oliver Dale Bagley. I've been in Reading. I've been actually in practice for 43 years, here for 33 years. Here on the Reading, California, and certainly have seen a lot of feet over those period of years, and it's good to see products that that we can use that we didn't have in the past. And even with some of those things we had in the past, the expense stopped them from getting these things. And there's some products out there that are good but still very expensive, and here we got something. And the other thing about most of these things are naturals, homeopathic things that we can use that are in the price range, and they work. Yeah. The other thing I think is important is that it started in the late 60s, and I know one of the most troublesome things was neuropathy, burning feet, and we had minimal things that would work. We would give them B12 shots. We would, we just, pain medication. We really didn't have something, and even to this day, it's probably the thing that we know the least about in controlling it. So this is certainly one thing that is simple, certainly doesn't have potential side effects, and can be adjunctive to other medications. So it's good to see, because when I see a person come in with burning feet, I say, oh, here we go again. I got to give my spiel that we're not going to cure it, we can control it, but it's certainly easier if we can control it with something like put a cream on. It's easy to do when you got a product good.
Yeah, it's a lot easier when you got one that
something is working.
Yeah. Well, that's really nice. Yeah. It sounds like you really found something that's actually really solid.
Yeah, I'd say in the past, my main treatment for nails is take them off.
Really?
Yeah. I mean, I still do if they're thick and they're not just mycotic, but I do a lot less of them because in the past we didn't have anything that was useful, that worked. It was just, in fact, if you read, it'll say no topical works, and then you had the oral, which worked maybe 70% of the time, but by 18 months later to a year later, they were back again, and that's what we saw. So there's got to be something, sort of a maintenance program afterwards too, even if you use the oral. And in severe cases, I'll use a dual treatment to get that when it's real proximal underneath the nail, and then I'll finish off with the topical. That's why I feel, because it's been, when I see them come in, I just sort of go cringe. I say, here we go. My feet, it's hard to tell them that we don't have a good cure. Either we give you something that knocks you out, and, amitriptyline and all those drugs that just sort of space you out so you don't feel it, but it has so many side effects, and there's a lot of these drugs in cost as well.
So this is beneficial just because it targets that specific area. You're not using something oral that's going through your whole body.
Yes, yeah. So we don't have those side effects, and the cost of this. One of the biggest troubles with the compound is just the sheer cost. I give them a sample, and they like it, and they say it's working. Then they see what it costs, triple or more than this, and not any more effective. And so it certainly has a niche for pain, be it post-op pain or neuritic pain.